Good evening. Welcome to Macquarie Business School. My name is Lan Snell. I'm the course director for the Global MBA at Macquarie Business School. We're broadcasting live from Sydney, Australia, and it's great to have your company. The topic for the webinar tonight is the importance of clear communication in a time of crisis. COVID-19 clearly is a pandemic of unprecedented times, and it kind of demands very clear, consistent and compassionate communication. Crisis or no, effective communication is an extremely important thing. I'd like to welcome now our panelists who are going to join us for this discussion, Lucy, Patrick and Robert, and I'm going to ask each of you to briefly introduce yourself to the audience. Lucy. Lucy, you're on mute at the moment.
Terribly sorry, everybody. Hello, my name's Lucy Morgan and I'm a lung doctor here in Sydney. I'm part of this great webinar tonight, I think partly because I'm a lung doctor caring for patients with COVID infection, but also because I'm a clinician working in predominantly public practice, but also heavily involved in the university training of future doctors at the University of Sydney and Macquarie University Hospital. I'm also involved in patient advocacy and education through my role as a director of the Lung Foundation of Australia board. And perhaps most topically, because I've recently contributed to a document that you'll have in your briefing papers after tonight, a document labelled The Roadmap to Recovery, which was developed by a group of eight universities here in Australia to give advice to government, to our government, about how to make our way forward through this COVID-19 crisis.
Thank you very much, Lucy. And Patrick.
Good evening, my name's Patrick McNeil. I'm the Deputy Vice-Chancellor for Medicine and Health at Macquarie University. And I've been in that role, I've been at Macquarie for about nearly 6 years. And that role has two aspects. One is being the Executive Dean of the Faculty of Medicine, Health and Human Sciences, which is one of 4 faculties at Macquarie University. We have about 5,000 students and about 700 academic staff in that faculty, and programs from medical education right through to psychology, linguistics, physiotherapy, for example, as well as medical research. And then the second half of my job is looking after or being the chief executive of Macquarie's health service called MQ Health. So unusual for a university in Australia, in fact unique. Macquarie University runs its own health service on campus, which employs another 700 clinicians, doctors and nurses, physiotherapists, etc., who look after patients both in a hospital and clinics. So I'm pretty passionate about both healthcare and education, which are both quite complex industries. I think they're things that really come together during this pandemic.
Thank you so much, Patrick. And our final guest is Robert. Robert.
Hi there. My day job, which is the job that is advertised under my name there, is as the Complaints Commissioner with the National Disability Insurance Scheme Quality and Safeguarding Commission, which is the quality agency for the NDIS in Australia. I think I am here probably more because of my history and my voluntary role. So I worked in the health system for 25 years, some time back, including working in public health, which is my training, and largely with disadvantaged communities. So I ran health services, but I did a lot of work in the Aboriginal health space and in communicable diseases. And I am, in my private life, my non-employment role, the president of the Australian Federation of AIDS Organisations, which is the peak advocacy body for the community HIV sector in Australia. So it's in some combination of those roles that I'm here tonight, I think.
Your wealth of experience will add a lot of value to the discussion. Clearly, we've got a very experienced panel joining us tonight, and I think that is really important to draw upon their clinical and extensive health background. It's very diverse. The health sector is a very diverse sector as well. So how this is going to work, this is a conversation. We very much invite you to be part of this conversation. Please send in your comments and your questions, and we'll do our best to address them as we go along. I'd like to open this conversation up really by talking about what's going on, just some broad scale sort of trends that are happening. Almost on a daily basis, we're seeing some sort of horror statistics coming out with sort of the number of people that are being tested positive, the number of deaths, unfortunately. And so it's really unprecedented times that we're living in. For Australia and New Zealand, I'll have to say that that curve is flattening in a very positive way for us. And, you know, perhaps we're doing a number of things that might be considered right, but one of those key things, and it is still a very contentious thing, is the role of communication and the importance of communication in a time of crisis. The slide before you, there are three central things that we're going to sort of touch in. They're not mutually exclusive categories. We're probably going to interchange between them, but we'll be touching on what is best practice in terms of communication, and you know how we actually communicate consistent messages in a time of rapidly evolving changes, almost on a daily basis. And, you know, how do we establish trust and credibility amongst all these things? So these are some of the topics that we're going to entertain as we tackle this area of communication. Now, you might be wondering why Macquarie Business School. So Macquarie University is a large university in Australia. In Australia, as you know, or you may not know, we have guests coming in from all over the world. I know that we've got some 1,600 people who have registered for this event, and it is a global audience. But for those who may not know, Australia consists of some 38, I think it's 40 providers in Australia. The higher education sector is a very a high quality sector, and in fact Australia's third largest export sector at $40 billion. Macquarie University is a large university based in Sydney, Australia. We also have the hospital on campus, as Patrick mentioned earlier. So we're going to draw upon our extensive background and expertise in both the health space and also the business space. We're hosting you, the business school is hosting you as part of this. It does also reflect the very interdisciplinary nature of how we go about doing things. I mean, whilst health clinicians and practitioners are expert in their own domain, I think that the abstract we talked about is that you can be a genius, but you can be a genius in your own mind if you're unable to communicate those key messages to people. So that's a preamble of our conversation tonight. And then now I'm going to sort of narrow that down and anchor on that report that Lucy mentioned earlier about the task force report on the recommendations, which presented some 9 key principles of effective communication. But Lucy, can I just firstly ask you to just broadly give a summary of what this task force came up with?
So thanks, Lan. This task force was, or this document was really is very unique. It's the first time in my professional life and the first time in my living memory that a document of this quality and of this depth has been produced in such a short time. So this is the group of 8. So it's 8 of the biggest universities in Australia. And the group of 8 put together more than 100 researchers from a very diverse fields. There were economists, there were philosophers, there were clinicians from specific corners, there were scientists, there were psychologists, just a real wealth of academia. So great people with great thoughts who came together on an electronic platform. So we didn't meet in person, and we produced this document in under 3 weeks. So that's from woe to go. So I had a very small part in this. I was only one of those 100 people who contributed, but a great testament to multidisciplinary, web-based or electronic, platform-based real people coming up with real roadmaps to help us to get where we want to go. And it was the people coming up with the map that we presented to government and that they might help, I guess, lead us through or steer us through this very rocky terrain. And it's it's unnavigated terrain. We're talking about an environment for all of us, whatever part of the world we're in, that none of us have ever been in before. And that's true whether you're a primary school teacher, whether you're a farmer, whether you're a lung specialist, whether you're a bus driver, a policeman, whatever your role in this world, this is terrain we've never negotiated before. So this roadmap to recovery was a document produced by the people, if you like, and presented to government as a recommendation of a way forward, a path forward for us to get through this COVID experience.
Thanks, Lucy. And I think that the report came up with sort of 3 options that I'm sure all countries are considering. So I think the options are eliminate entirely, and what was it, suppression, and the herd immunity.
Yeah.
Yeah.
So look, the purpose of the report was not to tell government what to do, but to provide an evidence-based map of how we might navigate this. So the evidence as it fell out or as it was reported really ruled out herd immunity as a construct that we thought as a group was acceptable for an Australian context. That's not going to be the same for everywhere in the world, but for an Australian context, it was just not felt to be evidence-based or supportable. So really, we present the case for the first 2 options, elimination or minimisation, really, and the pros and cons of those two options.
Okay, so now I'm going to turn over to either Patrick or Robert to comment upon this. I mean, if it is that, in fact, we're faced with 2 options, either elimination and or suppression, which is probably a more controlled adaptation sort of approach, what role is communication in making sure that the public adhere to the instructions that's provided by clinicians?
Well, I think that this government's, the Australian government's approach actually shows a few examples of how to deal with a complex matter. And I use the word complex specifically rather than a complicated matter. And I think this reflects broader society in general and the way that industries have changed from the last century, which was a very, if you like, the Industrial Revolution, the end of it, to what is now the knowledge revolution or the knowledge economy. It has moved from thinking about things in a complicated way to thinking about things in a complex way. And if you think that those 2 words are synonymous, they're not. There's a whole area of study called complexity science, which sets out, a different way of thinking about the events that we are encountering in the world at the moment. And this isn't the first. 9/11 was another one, the global financial crisis, even the downfall of the Berlin Wall. These were all unexpected events, and that's what the world will face. And then if you want to narrow down from the world to industry, the 2 industries that I'm involved in, healthcare and higher education, are also incredibly good examples of complex, where complexity science has its role. And so leading in those industries requires a different skill set of leaders than the previous century, where, you can say, well, putting a man on the moon, that's complex. Well, it's actually not complex, it's actually complicated, because you can actually figure out how to do that using, mathematics and physics and, economics, and you can be fairly certain that you'll be successful. In a complex environment, you have no idea what will be successful because it's characterized by emergent issues rather than predictable events. And so I think the communication has to adopt that same approach of communicating about a complex matter, not a complicated matter. And I see examples where politicians and leaders try to communicate about a complex matter using complicated language with single solutions. And I think the example of providing options is a good example about how really good complex leaders make decisions. Decisions are rarely based on perfect evidence. They usually require a high degree of judgment.
Yes.
And it's a mix of using the leader's experience, their gut feel, and the best available evidence, which in every complex situation is incomplete. And so I think that, the task force providing 3 options, one which was fairly quickly eliminated, and then 2, which were pretty good ones to think about, really gave the leadership a good way to make a decision. And it doesn't matter which one the government chose. I think, that they were both reasonable things to think about based on the best available evidence from a set of experts. But I think the other thing about this government's approach, this National Cabinet's approach, has been to be adaptable, to be nuanced, to make decisions that haven't been black and white. And I noticed very early in the pandemic in Australia, there were a lot of strident voices that were singing out for simple solutions, which were quite draconian: shut all schools, lock down everybody. And I felt that was really driven more by the underlying anxiety of the person calling for that than a leader who was making, a decision about a complex matter.
Complex being the operative word, right? It's actually fantastic that you touched on, because I can see a question that's come from Fred, and he asks about, let's address the elephant in the room, and that is politicians who are often the spokespeople, are lacking the credibility. And yet here we have a panel of 3 health experts. So the issue of trust and authenticity in actually communicating messages that are clear. So let's talk about that, because I think that is a really good point. Thank you, Fred, for making that, bringing that question in. Would anyone like to comment about this?
Maybe I should have a go. So can I just go back to the report? What the report did for me was to put suppression on the agenda. So if you think back to early on, we faced a number of material disadvantages: the infectious nature of the virus, and the fact that it was hard to judge how far it had got, and the lack of testing technology and then volume. And so by default, we were in a sort of control environment. And this report and some of the excellent scientists involved said, actually, just let's remember, in non-pharmaceutical control of epidemics, pandemics like this, our ideal case is actually to know who's got the disease and to isolate and actually to suppress. And so I just wanted to make an acknowledgement of the people who wrote this report. I think well, I'm not sure they changed the course of it, but they opened up a kind of realm of discussion. How did to segue to the, to how did the politicians respond? I mean, I think they captured a lot of credibility with some reasonably clear communication, very fast, in a very, very complex environment. And in fact, the contribution of this report, though an option was not forced, in some ways was to increase the headroom and the thinking. I'm saying that as an outsider. I'm no longer inside the health system. I should be clear about that. So I'm not speaking to some, disclosing some conversation that I saw going on inside the system. But my read of it from outside, as an ex-guest participant, was that this report opened up consideration of an upper end, tougher set of measures. And what I saw, you know, with a couple of reasonably minor missteps, what I saw the senior public health officials and ministers, the Prime Minister do, and the premiers, was to actually fairly rapidly adjust their audience to hearing messages that even a week or weeks before would have been unsaleable. So I saw, so I guess my first observation is a positive one, that I saw the way they were able to work together here compared to some other parts of the world, actually carefully and I thought quite deliberately stepped up Australians' sense of behavioural responsibility and the efficacy of our response. And this expert report, I think, fed a sense of we could go further as long, and we respected the politicians. We health people respected the politicians to have a feel, as I think Australian politicians do, for how far and how fast they could take the Australian people. Now, we'll come to the way back down and the judgment they have to make about other factors than disease control. Leave that for now, but that would be my comment. I actually think, yes, there were some very critical voices and so on, but by and large, there was a positive relationship there and quite an effective strategy to step Australian people through the growing realisation that the options and to change the messaging as some extra evidence came to light.
Lan, could I make a comment, please? I'd just like to use a personal anecdote to bring up two issues. One is the issue of credibility. Who is it that's delivering the messages? Who is it that's telling us the messages? And the second issue is that of, well, they're really both out of trust. And it's the aspect that the most successfully delivered messages are those that are delivered by somebody that you trust, that tell you something that either really matters or you want to hear. And I guess there are different ways that we can play with those kinds of ideas. But they're also messages that are delivered in ways that you can understand, whether you've got a PhD in nuclear physics or not. And so it's about language. And there's got to be some kind of emotional connection at some level. And I think that's what we talk about. You know, we talk about empathy or we talk about compassion. But there's got to be some kind of emotional connection between the person delivering the message and the person receiving the message. Mm-hmm. And so, and the reason I'm going to use a personal anecdote is that I became involved in the Group of 8 document preparation really as a consequence of a very brief media appearance. I don't have a major media presence at all. I'm a doctor. I look after patients. I'm here for patients. That's my job. But I appeared on an ABC television program here in Australia that's called Q&A. It's a panel format program that tackles topics of the day or the week with a host and usually a variety of panelists, somewhat similar to what we've got that Lan's brought together tonight. So everybody that's on the panel will bring a different aspect to the discussion. This was a special Q&A episode around the COVID pandemic, and it was particularly formatted to be not the politicians but to be stories from the front line. So I was part of a panel of clinicians of various types, working in different parts of Australia in slightly different clinical contexts, and our experiences with dealing with the COVID-19 pandemic. There was politics in it because you can't avoid that kind of panel discussion without there being political discussion, and there were politicians who did speak in that program. but the clinicians amongst us spoke about our clinical experience, and there was a sense that it changed the flavour, the temperature, and the direction of the public debate or the public conversation about COVID-19 in Australia after that program, which was filmed live, went to air. Now, it wasn't me, but it was that coalition of clinicians. So it was perceived that we were giving messages that people could trust, that we had some credibility because we kind of know what we're talking about when we talk about the patients that we've been dealing with. And it was a very emotional episode for me because I was able to tell the stories of looking after patients who've been critically unwell with this disease. So it wasn't a flattening of the curve conversation. I wasn't standing in front of a graph and I wasn't pointing to numbers. I was telling a story about real people that could have been the audience's mum and dad, could have been the audience members themselves. So I think that episode of Q&A really reminded me of the power of the story being told with a personal bent, being told by someone who's got credibility, who kind of knows what they're talking about or is perceived to know what they're talking about, someone who is trustworthy, someone who's clear, and someone who can tell you a story in words that you can understand, and consistent. And at the end of the day, someone who you feel you would want to look after you, you know? I mean, and that might be the case whether it was somebody from banking, somebody driving the bus. As it turned out, it was somebody who was looking after patients. So I guess that's another aspect of how we do change the landscape or change the map or change the messaging, depending on who's delivering it, what they say, the sorts of words they use. And I guess the other thing is about being very proactive, and this is something that we brought up in the document, the Roadmap to Recovery, proactive in combating misinformation, calling out fake news, or reassuring people when that we are not going in a specific direction. I guess reining people in or reining in the emotion is also a very important part of message delivery. And also being able to understand that we don't all speak the same lingo. We might speak the same language, but there's issues of dialect, of cultural diversity. We all read these messages from our own little corner of the world. So those are some of the aspects that I think are very, very important about communication, particularly verbal communication, in this time.
Yeah, thanks, Lucy. I mean, great insights that you shared with us then. And really, in many ways, it does address many of the 9 principles that the task force has sort of recommended in terms of what is effective communication in times of a crisis. My summary from what you're saying, what I was hearing is you were being human in those touch points. And
we don't want robots as our doctors. And in defense of politicians, most people don't go into politics to be the Minister for Main Roads. And so, the Minister for Health has a role in talking about the government's approach to health. And so they have credibility as a minister, as a member of the government. But when we're talking about health, particularly bad health, and particularly dangerous, scary, unpredictable, widespread bad health, then I think what we're looking for is people to deliver the messages that have a different sort of credibility and can be trusted.
Indeed, and I think it's a really great point now to go back to the audience, and I know there's a few questions that are coming through. Some of them I can group into a cluster in terms of the same theme. But one of them is quite clear, and this is about how do we communicate effectively in a community where a large percentage of the public don't even believe that the pandemic is real. Before we answer that question directly, I just want to also entertain this other notion as we're talking about trust and authenticity or distrust in this conversation. And whilst this might be the case, we're sharing glowing examples in Australia. That is not the case globally. So we're seeing in the US, for example, the president, they're making some sort of associations with disinfectant, etc. That you talked about fake news and calling it out. We see inconsistent and dangerous messages coming out of Brazil as well. So what is the panel's view to that as well? Let's talk about the issue of trust, authenticity, and also communicating either to a public that does not believe that a pandemic exists and or fake news as part of that conversation. I'm going to firstly ask Patrick to comment on this.
Look, I think it's, the pandemic has been an unexpected and shocking event. And I think everyone in the world, Australia included, has underestimated the seriousness of it right from the start. And I think there's some examples of countries that have continued to do that and are now paying a very heavy price. I would say Australia, there was a bit of that. And, in myself, I felt that that some of the messaging early was a little bit probably too strong. And so I think it's a natural tendency in all humans to not, well, people may react in different ways. Some people get very quickly alarmed. Others are a little calmer and then tend to underestimate it. So you find the right balance eventually. So I think that was a challenge for everybody to underestimate. And that's why I think the incremental approach that the Australian government adopted and really relying on expert advice right from the beginning, and actually having a very strong public health unit, in the States, which we probably haven't appreciated how deep and strong the public health units in Australia are. Mm. So I think we had a number of factors in our favour that allowed this country to buy some time. And in complex issues, time is the best saviour for you, because, as I said, the evidence is rarely complete, and often it evolves over time, and then you can make a better decision, even a week later than you could have done a week before. And unfortunately, many countries in Europe never had that luxury of time. The infection really became too widespread in the community, and then put their health services in a very difficult place where there wasn't the range of options. Look, I think with all issues like this, leadership is absolutely critical. And if you don't have leaders who are naturally good at dealing in complex situations, and we see them Lucy and I see them in the health system. The health system is by far and away the best example of a complex adaptive system. And we see leaders of our public hospitals and all sorts of private hospitals and everywhere in our universities, in medical education, all sorts of places, who are just not good leaders. And because health really selects out people who actually, whether or not they wanted to be a leader or not, they often end up being a leader in the health system, a successful leader, because they're good at dealing with complexity and making decisions based on their own experience and on the run, using evidence, because we're all scientifically trained where available, but we don't lock ourselves into simple solutions to things that we know are incredibly complex.
Patrick, can I tease you out on that? What is it that you think, from a communications point of view, that makes for a good health leader, which of course is translatable across the board? We do tend to have scientific backgrounds. We are good at juggling, at sifting through evidence, weighing up evidence, but they're not communication skills. What do you think are the things that make for a good health leader from a communications point of view?
Well, you touched on it in what you said before. It is the empathy and the emotional connection. I mean, in general, doctors are, well, we would hope, pretty good at communication. That's everyday part of our job in communicating with our patients. We understand the whole range of empathy. We have to deal with situations where we need to express, you know, intense empathy. And then in other situations, we have to control our own empathy that other members of the public couldn't understand how we could possibly deal with a patient, a set of circumstances that are just so awful, and yet we have to because we are the carer there. So we have incredible skills through our training and our experience that allow us to do that. So in general, medical doctors and nurses and other health professionals are actually pretty good communicators because they can connect with their audience often. And so that's a pretty important thing. I think it's also this adaptability, and we do have the ability in general, and, you know, we shouldn't generalize about the medical profession saying what wonderful people they are in general, but you know, there are probably a greater percentage of people in the health professions who can see different perspectives as well as their own. They're often thinking about their client or their patient's perspective. They're often thinking about, you know, the parents of a child who might be their patient. So we do have experience in viewing things from different perspectives. And that's the sort of emotional intelligence that really helps in effective communication that you don't get with people who don't have that experience or skill set.
I sometimes think that it's easier to describe imperfect communication when things don't go wrong. And I think in a health setting, particularly in a pandemic setting like we've got now, those imperfect communication skills are held in high relief because they really stand out against good, adequate, good, excellent communication. And they're not health specific, I don't think. They are issues like mixing your metaphors, mixing up your messages, being inconsistent with your messaging, not delivering it clearly, using complex language, those kinds of things, letting your emotion get so involved that the emotion is all you read and none of the content. Those are the sorts of things that we hear about in health when it goes wrong. Those are the sorts of aspects that tend to come up in conversation when there's a healthcare complaint. It often ends up being a bit like speaking to your teenage daughter, you know, don't speak to me like that. It's got little to do with the actual message and much more to do with language and emotion, containing emotion or controlling, directing emotions.
I just wanted to pick up on that point. Patrick, you mentioned that, you know, generally we don't want to generalize. I think what is safe to say and to generalize is that people do understand the importance of the role of communicating in making sure that they deliver the best patient outcomes there, right? But it is also a fact that many health clinicians are not the best communicators. And so this whole notion of bedside manners or lacking thereof is very much there. So this is the importance of, you know, combining different discipline groups. And look, I'm not sure whether communication or leadership per se is part of the curriculum that we take our health clinicians through. I mean, it's probably more important that they save a life or, you know, a domain's expert in that particular domain of expertise rather than these other sort of add-ons. But that's not to say that that's not important either in having a holistic approach to that's centered on the patient. And I'm sure others can comment on that. But I just want to turn to some questions that have come from the audience as well. Kylie has posted a really good question. But before we get to that, I just wanted to bring in Robert into the conversation. Robert, in terms of, there's a number of questions about the rapidly evolving nature or the changing situation of COVID-19. How can we be consistent in communicating those messages? Now, I know you've had a lot of experience with SARS, for example, so perhaps you might want to comment on how we deal with a very rapidly evolving situation where the consistent communication may be misinterpreted or changed on a daily basis.
So a couple of comments that sort of segue to that from the previous conversation. So this isn't on, so if we rely on doctors and politicians, we won't succeed in communicating with everybody. the questioning that goes to how to communicate to the greatest breadth of citizens, and including those who don't necessarily trust the medical world or to trust the political world. There's a great virtue in mobilising people within communities. So if you look at the example of the HIV epidemic, the behaviour change there hasn't been driven by medical expertise or messages from government. It's been driven by messages that both have supported and enabled, but delivered through communities. And so I think this has been a pandemic that impacts everybody, but mobilising communities is adds a framework and a scaffolding of strength to what we're able to do through the public health world. And we've seen some success of that through business communities and through other communities to reinforce messages. Another point, these are slightly disconnected, but I think they do come together. Another point is crises like this weigh on the fracture points in your society, right? So if there is widespread distrust, it will get worse. And the points, and so if you have a polity that is characterised by distrust and by populism and a tendency to turn complex messaging into complex reality into conflict, that will be exacerbated. And so that isn't just a communication challenge. And I think one of the challenges we face as communities and nations in the face of this is actually maintaining the efficacy of liberal democratic institutions and tolerance and support for diversity and diversity of views. And so I think, well, it's another reason I'm pleased to live here and always think we could do better, and pleased not to live in some other places where you see a real threat to the public health message, but actually to the institutions that will rebuild communities and economies as well. Your question about the complexity of messaging and not confusing people. Well, in the early days, you're asking people to do something when they're most alarmed and reasonably simple, and it kind of gets more complicated from there, right? So winning trust for mass testing, sharing evidence that is emerging, such as how safe it is to send kids to school, and kids are at school, which is actually partly new information and partly changes in the actual epidemiology of the virus in the community, is inherently complex, and it gets kind of more complex from here, right? So we will be saying to people, giving advice to people as a country which requires much more judgment. How do we share our workplace? Where I work, we have to start a conversation about, okay, do we change the times at which people come to work? How do we distance within work? It's more complex, and will be flare-ups. So those things add to the importance of the two previous points I made, I think, because the next period, maybe not as frightening, but it's more complex. It's inherently more complex, and we'll learn more, and so there'll be emergent knowledge and emergent issues. And I think it's very easy to criticise changing messages, but the changing messages in part reflect changing knowledge and will now reflect changing and complex reality. So coherence of community, really underpinning frameworks of civility, and mobilising a wider diversity of communities of engagement, I think are very important strategies going forward, not in any way that are undermining the continued importance of our political and medical leaders.
Thank you. I'd like us now to bring our attention to a theme of questions coming through. And I'm going to read out a question or comment from Rushi, and this kind of is reflective of a number of comments, similar comments or questions coming through. And that is, how can we communicate better with people who, despite powerful messages from credible sources, find it difficult to change the way of life? So that's a common question that's coming through from the audience. I will hand it to the panel to sort of comment on this, but if I may offer my view on this one. So this is about essentially creating confidence in people to change their way. There's a number of different theoretical frameworks that we can draw upon. Probably the most effective one is from Bandura, and he came up with this concept called social cognition theory, and the underlying premise of that is what we call perceived self-efficacy. And so this is building mastery and confidence of people, particularly when we're considering the adoption of novel health adaptation sort of behaviours. It's been the most significant construct to affect that behavioural change. So we know that the literature has come up with a number of findings that support the role of perceived self-efficacy in guiding behavioural change to this. And so that in part addresses that question, or those sort of sets of questions coming from the audience. That is, it is about making sure people feel confident, and how people feel confident, it comes back down to communication. So clear communication. So there are a number of variables that affect this and enhance that relationship, by the way. One we've touched on at length during this conversation is the role of the health practitioner, so the health provider, in delivering that sort of communication. You must do this, 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 and this. Those clear instructions delivered in a very sort of a way that connects and people understand. So I'm just going to open that sort of question from my perspective. I'm not a health practitioner. I come from a business background, but now I'm going to ask any of the panel members to comment upon this question, please.
I would say that it's a combination of trust and pragmatism from a community member's point of view. They've got to hear a message from someone that they trust at some level, hopefully a high level, and they've got to, the message has got to say to them, this is important enough for me to do something about, and I've got to have a plan for what I can do about it that is acceptable for me. It's got to be pragmatic. Now, I've got to say, living in Sydney in 2020, that pragmatism looks very different to if I lived in any of the enormous cities in Southeast Asia. Pragmatically, how do I stay more than 2 meters away from the next person that I live with, or that I have to move around my life with, if I'm sharing 1 kilometer with multiple, with 6 million people? That's pragmatically incredibly difficult. If you live in sunny Sydney, where you might have a family of 4 living in at least 800 square meters, that's a very different way of being following that instruction. So I think the successful communication package takes into account those issues of trust, somebody credible telling you something that means something to you, and there's got to be a level of pragmatism. Can I physically do that? Can I practically do that? That would be my comment.
Yeah, I mean, I talked about complexity before, but actually I also want to talk about simplicity. And I think in communication, even though you may be dealing with a complex issue, and as a leader you may need to be using a whole bunch of data sources and judgment to make a decision. In terms of communicating your decisions, it's actually better to have, to not bother the hearer about the complexity, because that's a very effective way of them getting lost. And you actually need to really make your message in a way a bit simpler than it really is. And I think we have some examples of that. With social distancing in Australia, the message was fairly simple. Rather than people saying, oh, what about this, what about that? It was pretty simple. It says, stay at home unless you've got a reasonable excuse to leave. And the reasonable excuses were 4 things. It wasn't 40 things. It wasn't 15 things with 6, sub-clauses. It was 4 reasons to leave your home. And that's overly simple. People say, well, it might not be consistent. What about this? But I think the communicators, generally politicians or the chief health officers, were effective in their communication, because they stuck to a fairly consistent message that was understandable. Not everybody liked it. In fact, many of us didn't like it. many of us look for reasons why maybe did we fit into one of those reasonable excuses in our state. But it was consistent. And I think the other thing, so simplicity is one thing. I think consistency is important, although, as Robert says, the message can change when events change, because we are talking about emergent things. But, you know, the wearing of face masks in public was a good example of consistency, where the best evidence was that this is not helpful in protecting people against catching COVID-19. It might be helpful in not spreading it if you have it. And there was another, you know, driver there in terms of shortage of face masks, that actually every member of the public wearing them was not going to be a good thing for the whole thing. So, and that was challenging, because there are strong cultural reasons in Asian cultures that wearing face masks is a healthy and socially respectful thing to do. So consistency and then a degree of simplicity, I would say, are two important things.
I'm conscious of the time. We've got about just under 10 minutes remaining from this webinar. I just want to go to and address perhaps one or two more questions coming in. One question coming from Kylie, and this is back to you, Patrick. Patrick, what role should universities play in contributing effectively to the debates and responses to major crises such as COVID-19, in addition to the document that Lucy was involved in developing, that I think is the task force document. So what role do universities play in this, Patrick?
Well, I think the document was a good example. I think universities, you know, in this country are not particularly kind of viewed with great affection by governments, I think it would be true to say. However, you know, universities actually have, you know, a very good cross-disciplinary sampling of, you know, of experts. Now, there's experts and experts. You know, they may not be practical experts in some disciplines, but many of them are. I mean, in many of our you know, faculties or schools or colleges within universities have, you know, some of the national experts in health or business or engineering or law. You know, and they're regularly consulted by media to give a expert commentary on social issues and political issues and legal issues and health issues. You know, so it makes perfect sense when governments want to, you know, get some collective thought to go to universities and, you know, and tap into that kind of fountain of, you know, reasonable kind of wisdom, we would hope.
Mm. Okay, I think we've got time for one final question, but in fact, this is a number of questions that are coming through, again, representing a common area, and this is the role of communication in the era of digital and social. So who would like to quickly comment upon that? I might open to ask Robert and then Lucy to comment on the role of communication in this era of digital and social instant sharing.
Well, I think people who know me would know that it's kind of funny you would go first to me on digital communication, social media, as a non-participant. But I think I would take the opportunity to underscore the point I made about reaching the diversity of the people you've got to reach through channels and through voices that they're more likely to trust. So I had a previous life where I was responsible for university policy, and we put an enormous amount of energy in the university sector and government into creating this very valid way of comparing the experience of students in different courses and universities. I won't go on about it. And then I remember having these conversation with my stepdaughter, who was choosing which university to go, and saying, why don't you go and look on this website? Completely no interest. And I tried to hide my personal kind of hurt and disappointment and asked how she was going to make that choice. And she said, well, I'm just chatting to people on socials. I'm just harvesting data. and made a completely workable set of choices. So I think the point is you would ignore any channel that reaches any part of the population at your peril. I think there was somebody else asked about the citizenry's responsibility also. Mm-hmm. There's a real question about channels and intermediaries and people who speak for communities and are listened to, and through channels and are listened to. And that I would use to underscore the point about social coherence. Social media can be a fantastic force for coherence, and it can be a force for fake news and distrust. So it's not a space to ignore.
Indeed. Lucy, I might ask you to sort of summarise this in a minute or two, as we've got, we need to close off on this session.
I'd just make the point that this document, this roadmap to recovery, has been an extraordinary document by the people, if you consider universities to be full of clever people, members of the community, and it's for the people. So this is a document that went to government but is freely available. It will be available to everybody that's online tonight, and is written in a way that most of us could understand, grasp, grapple with, think about, and make some decisions based on. And I think that's a great example of how communication via it wasn't done via WhatsApp, but it was all web-based platformed. It was email. There was no emailing. It was all the communication all happened electronically, and it's provided what I think is a very credible document.
Yeah, it's a great example of a dynamic and crowdsourced way of producing a document
and a living document in a short period of time, acknowledging that things are changing so quickly, but we have to be agile. We have to be able to grasp things and change our minds if the grounds move under us.
And a lovely way to sort of summarise and wrap up. And I'm going to just turn now to our final slide of this evening. And this is coming back to the whole premise of our discussion. That is the importance of effective communicating and communicating with impact. So one of the things that I hoped to showcase tonight in having this sort of like a multidisciplinary sort of panel together comprising of health experts from different domains, and also working in conjunction with the business school here at Macquarie University, is to reflect how important we regard working together in diverse teams. The points that Robert made earlier about bringing together a whole bunch of different experts in this. It's no accident, no coincidence that one of our most popular courses within the Global MBA is what we call the Communicate with Impact course, with over 55,000 unique visitors. It's one of our it's our highest course of enrollment. Clearly, people want to understand how to better communicate with impact, how to tell that story with a front end and a midpoint and an end point there. What is that narrative? So this is a course that has resonated, and there's a clear demand out there. So I would encourage you, if you're interested, to have a look a bit more about that. If anyone is interested in understanding a bit more about the Global MBA, Macquarie Business School and Macquarie University, please feel free to contact us. But I hope you've enjoyed the discussion that we've had tonight about tackling the complex issue of communicating in a time of crisis that is COVID-19. Certainly enjoyed this discussion and this conversation. I'd like to thank our panelists, Lucy, Patrick and Robert, in sharing their insights and their experience to the discussion. Thank you very much to our audience for sending in your comments and questions. There were lots of them. We hope we touched on quite a few, but didn't get to quite all of them, and hopefully we'll come back to you in terms of a post email to you with this recording and some other documents that you can look forward to. Without further ado, we say good night from Sydney, Australia. Thank you very much for joining Macquarie Business School, and thank you again. Good night.
Thanks for having us.